I want to thank everybody who's presented so far today, which spared me the need to put data up. So I have no data on my slides. I'm going to try to, but think of every data slide you've seen up here because it leads to what I want to do. So I want to do a shout out to Nancy Adler about this is going to try to put a little bit of vigor along with the rigor. I think if we look at how science has been used in early childhood policy for the last decade, it's been mostly focused on making the case for why and what. And I think there's still more work to be done there, obviously, but now we have to start using science to answer the question of what next. So my presentation here is going to really focus on how we bring biology into early childhood policy and practice, because it's not there. It's not even at the edge of the radar screen. And the key, from my perspective, is to focus in on our understanding of causal mechanisms that will lead us to come up with some new ideas about what we might do above and beyond the best of what we do right now. So, where's my clicker? So this would be the one-slide summary for the policy world of everything that's been said today and everything that will be said tomorrow and everything that's going to be in the PNAS journal, which is that early experiences are built into our bodies, for better or for worse. And this is something we can explain to policymakers, that research on the biology of stress illustrates how increases in heart rate and blood pressure and blood sugar and stress hormones and inflammatory cytokines, we can explain what that is, are all part of the fight or flight response that everybody kind of understands on some level, which is a response to acute threat, which is kind of built into the biology of all animal species, but excessive or prolonged activation of stress response systems can lead to long-term disruptions in brain architecture and immune status and metabolic systems and cardiovascular function and all of the health and learning and behavioral difficulties that have been addressed today. So this is the science message to the policy community, where the excitement in the scientific community about what we disagree with about it. I make tribute to Bruce McEwen, who was one of the people who first told me that it's not just about the HPA axis, even though you've done that, but that basically the excitement in the frontiers of science is irrelevant to the policy arena. What's relevant to the policy arena is that all the scientists agree that excessive activation of stress response systems causes physiological damage to the brain and other organ systems and is at the root of most of the social problems that cost a lot of money. And, by the way, once you know the science, it's a huge moral imperative to just walk away and say, not my problem, even if you can't demonstrate the benefit-cost issues. So what I'm going to do is, in 30 seconds, kind of take a bird's-eye view of the last 10 years of early childhood policy in North America. And the first thing will be an interesting contrast to the wonderful presentation that Leah did. But if you look at the last 10 years of early childhood policy in this country, while this scientific revolution has exploded, it's crying out for new ideas. This is not just about we need to put more money into programs, we need to improve the quality of programs, both of which are true, but the crying need for new ideas, and you can see where I'm going. If science isn't going to produce the new ideas, nobody's going to come up with anything better. So, interestingly, unlike the situation in the developing world, where the problem has been to get development onto the radar screen, because it's mostly about reducing preventable death and serious illness, in the developed world, or at least my whole orientation here will be U.S. and Canada, the primary focus has been on school readiness and access to health care. Essentially no investment in the last decade in any new strategies whatsoever to reduce barriers to learning or to promote health or prevent disease. It's an education policy issue. It's about preparing kids to be better able to succeed in school, and it's, by the way, make sure they have a doctor. Okay, that's the health agenda in the developing world in North America. In this period, these are just U.S. data now, there's been a threefold increase in state expenditures for pre-K programs in the United States, from 1.6 to 4.5 billion. At the same time, meanwhile, back at the ranch in the medical world, dramatic advances in biomedical research and treatment of complex diseases like cancer and cystic fibrosis and HIV/AIDS. I'll just use as one anchor point here. When the modern era of early childhood policy began in the United States in the 1960s, this was the war on poverty, the Lyndon Johnson administration, this was the birth of Head Start, community health centers, school lunch programs. None of that existed before that. At that time, acute lymphoblastic leukemia in children had a 99% mortality rate. Almost 50 years later now, we're still arguing about the effectiveness of Head Start and the other programs that followed it, and the survival rate for acute lymphocytic leukemia is now about 98%, and you can tell at the time of diagnosis which subgroups are likely to immediately respond to conventional treatment and which are going to be more likely to relapse. But we've used basic science to improve our ability to treat disease. Now, I'm not comparing leukemia to poverty, but I am saying that there's a message here, which is when we went from 99% fatality, and it didn't go in one step, but let's say years later we got to 50% survival. No, but the field was not saying, let's just make sure that everybody gets the treatment that produces 50% survival. Some part of the field worked relentlessly until it got to 99% survival. We do not have that analog in the early childhood world. We are still fighting the battles of getting funding for programs that were developed almost half a century ago. So after 10 years of this revolution in biology, we have growing economic inequality. We have increasing obesity and increasing diabetes disproportionately among poor children and children of color. No significant reductions in social class disparities in education or health outcomes in the face of programs that make a difference. Okay? So I'm not saying that the programs don't work when they're done and when they're done well, and I'm not saying that we haven't demonstrated significant. I mean, Greg has been magnificent, among others, in showing the return in dollars, but think of what the outcomes are. So one of our two big outcomes are high school graduation and reducing incarceration. Incarceration is the big money saver, and we get big impacts when we do this right. So we can get the high school graduation rate up to 80% instead of 50%. And when we started these programs, a high school diploma got you the ability to support a family out of poverty. That doesn't work anymore. So we're so out of whack in terms of the way we're thinking about what the goals are here. And every time we prevent another incarceration, we save huge amounts of money. Perry Preschool, which is, you know, the goal, we squeeze another drop of blood out of the Perry Preschool database. But, you know, that had huge impacts. The treatment, 2/3 of the treatment group ended up in jail, and under 50% of the control group ended up in jail. Only a little less than 1 out of 2 ended up in jail. It's not time to pop the champagne. So the question is, what do we do? And so now I'm going to very quickly, how am I doing on time? Because okay, great. So this is the current conceptual framework that's been guiding early childhood policy and practice for over 40 years. And it's still sound scientifically. It's necessary, it's just not sufficient. Some combination of parenting education, sound nutrition, providing stimulating experiences, both at home and in center-based programs, and health-promoting environments produces a healthy developmental trajectory. And the problem is, most of the time that's true, but in cases of significant adversity that we've been talking about all day, that adversity just overwhelms these dimensions of what the interventions are all about, and we end up with impaired health and development. So rather than look to advocacy for new ideas, I suggest we look to science, the science that we've been talking about here. And I think it has something very important to say. Now, for the rest of my 5 minutes, I have no data. This is just what we're thinking right now. And we're in the process of developing some laboratories to basically try some things to follow this enhanced theory of change that comes from the biological sciences that says that we have essentially an enrichment paradigm, an enrichment information dispensing paradigm, and it has to be complemented by a protection paradigm. We need policies and programs that will be engaged in new protective interventions that will somehow buffer children from the impacts of this adversity and allow the ingredients of the positive ingredients to maintain positive developmental trajectories. So you could say, big shot, so what do you mean by that? What are your ideas? So here's what we're thinking, okay? This is what we're thinking, but it's based on all of the science that's been presented today. So where might we develop strategies to enhance the life prospects of vulnerable young children? Right now, first of all, it's about reducing barriers to learning and about building foundations of health. So that's one big step. Policy in this country and in Canada is about education and school readiness. It's not about promoting health in terms of the biology we know. So what we do right now is we have child-focused strategies. On the education side, we have center-based programs and home-based programs that are providing this kind of information to parents and experiences for kids. And on the health side, basically, it's like primary health care is our answer. Aside from some of the public health measures, we say, do you have a medical home? Do you go to the doctor? I'm a pediatrician. I'll be the last one to say that there's no place for that, but it is not addressing the roots of the major threats to health of children in developing countries. We've been hearing that all day. So what might we do in terms of designing and testing new approaches to strengthen the capacities of the parents and the people who work in programs to mitigate the effects of toxic stress in children's lives? Another way to think about it is, what do we do while we're waiting for the elimination of poverty and discrimination and maltreatment? Okay? And so the suggestion here that we think the science is saying, we've got to build capacity of the adults in kids' lives to reduce or buffer the impacts of significant adversity, or what we call toxic stress. And all of these things have been touched on today. We know that mental health is a problem, not just for low-income mothers, but large studies coming out to show rates almost as high among providers in childcare as parents of depression among childcare providers. Not surprising, they're mostly low-income women who are working in childcare. Executive function and self-regulation, we've been talking about it all day. I'm going to say something about it in a second, but I think that's really a place to go looking, along with the fact that we build all these skills, but people still have no money to put food on the table. We're not going to reduce that adversity. The programs that focus on economic security rarely coordinate with the programs that focus on early childhood development. So why are almost everyone has touched in some way on executive function skills and self-regulation. And we've heard data globally and domestically that social class differences begin to appear. Now I'm going to start saying before a year of age. I was saying before 2 years of age until today. So let's fast forward it, because we don't have the data, so we'll have to do the thought experiment. Beginning in the first year, differences appear in self-regulation and executive function. You have variable experiences in early childhood and going to school, and maybe you graduate high school, maybe you don't, and maybe you have a job afterwards, or maybe you don't, but it's not a very high-paying job if you don't have much education, and then you get pregnant and you become a parent. Where did you pick up strong executive function skills along the way? How could anybody provide an environment for children in a home or a program who doesn't have strong executive function and self-regulation skills? And might those, in fact, be the key to the kind of abilities that can help buffer children and help build their adaptive capacities to be able to protect the physiological consequences of toxic stress? And here's what's wonderful about executive function skills, and it gets to the plasticity issue, and it gets to the sensitive period issue. The prefrontal cortex is the part of the brain that takes the longest to mature. It has the longest open window, and we know that there's a kind of a very steep gradient in terms of the development of executive function skills in early childhood and beginning into middle childhood, but we also know that there's another boost in adolescence and into early adult life, which, by the way, happens to be where most of the parents are of low-income children living in high-risk families. So the brain science tells us that window is still open, and our answer is advising people to read to their kids and give them books and say, I'll see you next week. So the suggestion here is that the science is sitting here waiting to be used, not to make the case for why to intervene early, but to say, what should we be doing differently? And so I'll leave you with this suggested thought that this is the conference's term. It's a new one for me, neurogenomic sciences. I like that one. So advances in neurogenomic sciences suggest that greater reductions in disparities in health and development are likely to come from more effective strategies for building adult capacities in executive function and self-regulation to protect developing biological systems in children who are living in highly adverse circumstances, and not just providing information for parents and enrichment for their children. So this is our website that has a lot of the stuff that we've developed to explain this stuff to policymakers, for people to want to see how we try to make the science more accessible. I'll stop. Thank you.